Mheshimiwa
Chair has
Speaker.
understood. Chair, please. Among the things you just been mentioned by, which you should take note of.
Thank you, Honorable Speaker.
For the benefit of the members.
Yes.
Some members, of course, and even the wider public.
Yes.
Explain also what's the difference between the SHIF and the SHA.
Yes, I wanted to begin from there.
One manages the other, but you have to really bring it out, yeah.
Honorable Speaker, the authority is called SHA, Social Health Authority. Social Health Authority manages three funds.
Yes.
The Social Health Insurance Fund, which covers for your health at level 4, 5, and 6. It also manages Primary Health Care Fund, which covers for your health in level 2, 3, and 4 outpatient. For 4 is outpatient services. And then it also manages Emergency, Critical, and Chronic Illness Fund. If you are using your Social Health Insurance Fund and you exhaust it, and you have a chronic illness, you are diabetic, you have a renal disease, you're on dialysis,
you still get the services.
You still get services, but now the services will be, you will be utilizing a different fund because you've exhausted your Social Health Insurance Fund.
Okay.
So it is managing those three funds. The Honorable Wamumbi talked about county health promoters. It is not county health promoters, it's community health promoters. Community health promoters are at the primary health care level. This is a network that each community health promoter is in charge of 100 households. And in these households is able to at least identify the illnesses that these people are having. You can be able to make diagnosis of this is a diabetic, this is hypertensive, and refer you to the health facility so that you can get proper treatment. And the role of county governments in community health promoters is that they are the ones, the county governments are the ones who recruit them. They also co-share the payment, where the national government gives 50% and the county government gives 50%, so that these community health promoters at least have something to take care of themselves. Initially, they were not being given anything, but now they are given a small stipend of 5,000. And it is paid by both national government and county government. And then the national government also has a responsibility to train them. Because you remember, I think this morning we've just passed a community health workers bill by Honorable Member for Ward Chief. That bill now will be able to provide for training, registration, and how these community health workers can be managed. My colleague, Honorable Mugambi and Honorable Kamuren raised about the issue of registration. My appeal here is that that we want all these people to be registered. Everybody, all the 54 million Kenyans must be registered, so that when the government is allocating funds for primary health care fund, for level 2 and level 3 and outpatient, so that through capitation, you can be able to access all those services. Every Kenyan has a right to access them without paying anything for level 2, level 3, and level 4 outpatient. For emergency, critical, and chronic illness, when you are involved in an accident, you have an emergency, you are involved in any emergency situation, the government, this House, has appropriated 2 billion to that fund, and it will continue appropriating more money, so that when you have a chronic illness, you have a critical illness, you have an emergency, you don't have to pay. You'll be admitted to any hospital, and that fund will be able to take care of you. And you remember the head of state said people have been selling their chambers to treat their patients. So we want to move away from that, so that you can be able to be, if you have a kidney disease, you can be able to be either dialyzed or you can even get transplant for the kidney. Both you and the donor will be taken care of, both pre-implant and post-implantation. You can also be taken care of. So this is the services that you'll be able to access without paying anything. But for SHIF, you have to contribute. For those who have pay slips, we are contributing 2.75%. Then for others, they'll do what we call proxy mean testing. My colleague here has asked me, what are indigents? Indigents are those who are not able to pay. You have constituents who are not able to pay, whom the government was initially allocating money through this house to pay for them. But now you have those indigents who are supposed to access services. You've asked about, you have elderly people within your communities. You have sick people who are within your communities, whom needs to be registered. We are appealing to you that at your constituency offices, we will send officers. The list is attached here. Under the Digital Health Agency and the Social Health Authority, their officers, we've given their contacts, given their names. You can get in touch with them. They come and assist you to have those people registered, and they'll carry out the proximity testing so that the indigents, the very poor of the community, can be identified and can be put into the program where the government can pay for them through this house, appropriating funds to the indigents, and they can be supported so that they can access all the health services without having any challenges, without them paying for it, but the government will be able to pay for it. So it is upon you now as honorable members to assist, to have these people, Chair, to have everybody registered, and the issue about challenges of people being registered, we are sending officers there to assist. And if you are in NHIF, you should not worry, because you must be transitioned to Social Health Authority without any challenges. And you should not be able to miss any service that you are in NHIF, now you are in Social Health Authority. You can still access services. Thank you, Honorable Speaker.
Yeah, honorable members, I think this was a statement which was sought, and we have given it a sufficient ventilation. Wednesday morning is for private members' motions. This is, order, honorable members, order. I will give one, and you take 1 minute also. Even under the standing order number 40, standing order number 41 is express. It says, even the chair who is making the statement cannot take more than 3 minutes without the leave of the chair. But the chair has been too generous. Now, you ask one question in half a minute, and let him take 1 minute also.
We want the chair to tell us who will meet the cost of those officers, where they are. He has given us the contact, so we want to know who will meet the costs and where they are located.
Okay, fair enough. And then ask one more question also there. Now, answer
Thank you, Mr. Speaker.
Thank
Thank you. The chair did not answer my question. My question was, what is the role of community health promoters on sensitization? Thank you, Mr. Speaker.
Chair, proceed and answer that. Cameron, you've already asked.
The Digital Health Agency and the Social Health Authority staff are staff who are on payroll. They are being paid for. You don't have to pay anything as a member. You are not going to meet the next. Their role is, no, I'm talking about those who are assisting in registering.
Yes.
Then the role of the community health promoters in sensitization. They'll be able, in the gadgets which they have, they can assist also in registration. And they can also assist in educating what services you can be able to access at the primary level, at level 1, level 2, and level 3.
Fair enough. Next order.
Order number 9, motion number 6 of 2024.